Welcome home to USA Global TV and Radio, a place where dreams take flight, with authentic storytelling, diverse perspectives and meaningful conversations, where global stories unite and bridges are built beyond all borders. Discover world-class education, entertainment, hope and inspiration. Together, we're building bridges worldwide. Subscribe to our channel, USA Global TV. Download our app, USA Global TV. Be our guest or join our team. Visit usaglobaltv.com. Thanks to our founder and executive producer, Dr. Jacqueline Kerbeck. Music score by Yeffy Tang from Cloud Road Music. Voiceover artist Mike Porter. Creative direction by Paul Garcia. USA Global TV and Radio. Your home for global connection. All rights reserved. This video and its contents are the exclusive property of USA Global TV and Radio. Unauthorized use, duplication or redistribution in any form is strictly prohibited.
Welcome to This is Floxed on the USA Global TV and Radio Network. This is Floxed is dedicated to raising awareness for fluoroquinolone toxicity syndrome, which is also known as being floxed. This means that a person is experiencing the adverse effects of a fluoroquinolone antibiotic like Cipro or levofloxacin and many others. If you are floxed, it is more common to be gaslit and misdiagnosed than not. Most people that are floxed are misdiagnosed with fibromyalgia, functional neurological disorder, FND, multiple sclerosis, and other somatic and psychological disorders. The harm of being misdiagnosed is twofold. First, as someone that is floxed, we are prescribed medications that are contraindicated with being floxed, and in most cases, our condition gets worse, not better. Second, with a misdiagnosis, that's the diagnosis and that's that. Doctors don't want to hear about any other condition, and therefore we are unable to seek proper treatment for our correct illness. The worst part about this whole situation is that even if we are correctly diagnosed, which is extremely rare, there aren't many doctors that even know how to treat fluoroquinolone toxicity. This leaves us feeling abandoned, hopeless, and stuck, and having to be our own doctors and put ourselves in literally financial ruin to treat ourselves through alternative medicine doctors that do not accept insurance. My guest today will talk about why people are so often misdiagnosed, what the gaps are between patients in the medical system, and what we can do about it. My guest today is Dr. Erin Nance. I know so many of you already know her as @LilMisDiagnosed, as she literally dominates social media and has an enormous following, especially on TikTok. Dr. Nance is a board-certified orthopedic surgeon, patient advocate, author of the best-selling memoir, Little Misdiagnosed, and the founder of Takeaway MD, a platform dedicated to making medical information more transparent and accessible. As Little Misdiagnosed, she has built a global following by amplifying patient stories of misdiagnosis, gaslighting, and delayed care. After years of surgical practice, Dr. Nance recognized a gap between what patients experience and what the healthcare system measures. Her work now sits at the intersection of clinical expertise, storytelling, and systems change. Through education, media, and digital innovation, she advocates for earlier diagnoses and restoring trust between patients and physicians. So with that being said, I'll welcome Dr. Erin Nance to the show.
Thank you so much, Talia, for having me. It's an honor to be here and to spend this time with you and your audience.
Thank you so much for being here. I've been waiting. I'm so excited for this. I know a lot of people are too. So I'll kick off the show. A lot of doctors we have on here are not part of the Western medical system, right? They're always like alternative doctors and stuff like that. So I'll kick off the show with the question, as a traditional Western medicine surgeon, how and when did you start noticing gaps in the medical system? And what made you become a patient advocate? Because there are lots of doctors that recognize these gaps but don't actually do anything about it.
Mm-hmm. Well, I don't think I woke up one day and said, I'm going to be a patient advocate. I think it starts with my upbringing. I was raised in a family of faith, a family that prioritized helping others, do unto others as you would want done unto you. And that's kind of just how I've always treated my medical practice. I think in traditional medical setting, there is a significant power imbalance between the physicians and the patients. And part of that is by design, right? We have a tremendous responsibility, to give the right treatments, the right medications. But with that responsibility comes, or with that power comes a great responsibility to understand that not everything is going to look like the textbook, and not everything is going to go out the plan the way that you hoped would happen. So what I was seeing was that online, there was so many people who were frustrated by their experience going to see doctors, getting treatment, and just having poor outcomes. And there really isn't a great place for people to express those frustrations, right? You may say it to your individual physician that you're frustrated or whatnot, but then that's kind of the end of the story. But online is where I found that these stories tend to mushroom and tend to gain steam because there are other people who are having the same exact problems. And for a condition that may seem fairly rare or even esoteric, like ciprofloxacin, toxicity, you realize very quickly online that you are not alone. And there are many people who are dealing with the same problem. So for me, it was just keeping my eyes open, listening to the stories that were presenting themselves online and saying, what could I do in my position of power to give validity, to give voice, to give visibility to these people who deserve to be heard and be seen?
Yeah, you definitely give voice, that's for sure. I saw your TikTok the other day when you were sick in bed, like, how long is it going to take to, come up with these cures? And if they were stuck in bed like that, even for one day, you were making the point that this is our lives for some people. It's more than just one day. So you have become an advocate for us as well as, like, for system change. So I definitely appreciate that. I read your book, Little Misdiagnosed, and I absolutely loved it. And I messaged you while I was reading it because there's something that we have in common there. So I just want to ask you, how did your brother Kevin's spinal cord injury accident transform your view of medicine? It had to have had some impact in some way.
Well, I'll tell you that this is the story of my first day of work as an orthopedic surgery resident. I'm starting on night shift. This is the culmination of years since I was in second grade and studied and wanted to be a doctor. And now I'm finally doing it. I'm finally an orthopedic surgeon. And on that first day, my brother was in a diving accident, broke his neck, and became quadriplegic. And what that experience, taught me was that everything that I had learned in medicine, I saw from a completely different lens because now it was personal, right? I understood why it's so important to be the family member at the bedside at 5 a.m. when the doctors are rounding so that you can ask questions, right? I understood how important it is to work with the social worker to make sure that, okay, we are sending you to the right rehab facility, and this is what's in the best interest for the family because they're going to be able to visit and give support, to the patient. So it really exposed me to the greater ecosystem of how a patient gets better beyond that doctor intervention. There are so many players, right? I'm sure, Talia, how many physical therapists and occupational therapists and nutritionists and social workers, did you work with in your, tenure to get better?
Yeah, and I mean, I think ultimately probably made you a better doctor, right? A more caring doctor, because you have doctors come in and they just blah, 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 they just say what they have to say and leave. They're not thinking about your family and everybody else that's involved, like you were thinking of the whole thing. And when you treat your patients, that's probably another reason why you've become the way you have. And I mean that in a good way, being an advocate and advocating for change. You're not just thinking about the patient, you're thinking about, like you said, the whole ecosystem.
Absolutely. I mean, when I, even if I do, a surgery on a patient, I will find their family. And then I always tell the patient beforehand, you will not remember me speaking to you. So I'm going to give you a call on my cell phone tonight, right? When the anesthesia has worn off. Because again, if you put yourself in their shoes, they're not going to remember anything that you said to them. So why, to me, it just makes sense. And it's part of how you would want to be treated as a human.
Mm-hmm. Yeah. I do want to get into this misdiagnosed stuff because I have so many questions and questions that people ask me to ask you. So, I guess the biggest question, in your experience, why do you think so many patients are misdiagnosed? And do doctors actually believe their misdiagnosis? Are they just trying to make any diagnosis, or is it something else? Because like in my experience, when I've been so frustrated, I'm like, what if they actually believe that's what I have? Or what if they're just trying to give me anything? Like, I'm trying to give the doctor some credit, but it's just extremely frustrating. So what's your take on this?
So I think you have to step into the mind of a physician. All right.
Mm-hmm.
And how we make diagnoses is on pattern recognition. Okay. And so for us, whatever fits the most likely pattern is what we're going to think is the most likely diagnosis. And part of the problem is, this is a great saying from one of my mentors, actually, his father, his name was Chit Ranawat. He would always say that the eyes only see what the mind knows. So if you are a physician and you do not know what ciprofloxacin toxicity is or what it looks like, you're never going to be able to diagnose your patient with ciprofloxacin toxicity. Okay. So you have to start there. And if we think about how medicine was practiced, maybe let's say 50 years ago, there was really only maybe like 200 diagnoses that were really out there, right? You had heart attack, you had stroke, you had, the big, large, but now there's hypertrophic cardiomyopathy, and there's so many different, and this is part of the research that we've done over these decades, but it just means that there are too many diagnoses for any one physician to keep track of. And it's one of the side effects of having a specialization, right? If you need a heart transplant, you want that heart transplant surgeon to only know about heart transplant, right? Because he has, or she has to be the best possible person at transplanting a heart. All right. They may not be up to date on the signs and symptoms of ciprofloxacin toxicity. Okay. That doesn't mean that excuses them from continuing to learn about things. But I think that is really just kind of a side effect of how the healthcare system, operates today. And this is where I honestly think that the use of AI can be so helpful in making diagnoses, because before AI, we were the AI. Okay. The doctor's brain was the AI. And not every doctor's brain is created equal, right? So that's why you have your Dr. House type people. And then you have other doctors who are everything, if they have a hammer, it looks like a nail. So I think it goes back to the eyes only see what the mind knows, and back to pattern recognition. And if there is a condition that is not on their mind, then you're never going to get that diagnosis.
I guess what my frustration in all of this is, okay, so people that are floxed, right? They'll get diagnosed with fibromyalgia. It's like a medical thing, right? But so many times we're diagnosed with psychological issues. So where the heck does that come into play? Because they're not testing you for any psychological issues. They're not sending you to any psychiatrist or psychologist. They're just saying you have some psychological issue when you're experiencing fluoroquinolone toxicity. So how does that happen?
Well, I think for conditions where, let's take strep throat, right? You go to your doctor, you say, my throat hurts, it's red, it's my voice is scratchy. They take out the swab, they swab your throat, and it comes back positive for strep. Okay. That is a nice little tied up with the bow diagnosis. We don't have that type of diagnostic capability for probably the majority of conditions that we treat. So, how are we making these diagnoses? It's based on, as I said, pattern recognition. Okay, you've got 4 out of the 5 symptoms. It's got to be this. But what we're also learning is that for a lot of these conditions, they may show up in patients differently, and specifically for women. We experience symptoms, like of a heart attack very differently from men. And if the prevailing thought for physicians is, oh, people who have a heart attack, that's someone who has an elephant, feels like they're sitting on their chest, they're struggling to breathe. For a lot of women, the symptoms of heart attack may be shoulder pain, feeling like something is off, right? So we need to have more awareness about what the symptoms are for conditions so that it does become, top of mind so that we're able to make these diagnoses.
Mm-hmm.
But to go back to your, the reason why I say this, because if you can't have a definitive diagnosis, then it becomes a diagnosis of exclusion, right? And psychological diagnoses, for the most part, are diagnoses of exclusions. Okay, you didn't have, this positive EMG and you didn't have any positive findings on your MRI. So we're going to go with anxiety or functional neurological disorder, because there's nothing to say that you don't have that, right? Is there anything to say you don't have fibromyalgia? Is there anything to say you don't have functional neurological disorder? Anything to say you don't have anxiety? No, that's just based on opinion. So it's a diagnosis that is a diagnosis, right? We physically have to give you an ICD-10 code at the end of every visit in order to even submit a bill. So you must have a diagnosis after you leave, and that's not to say that that's something that the patients know about, or that they should be like, well, I didn't even realize this was happening. What a physician should be doing, even if they don't know the diagnoses, they could still in their note say, my prevailing diagnosis is fibromyalgia, but it could also be A, B, and C. We should do further testing to see if it is A, B, and C. And it's really that step that is missing.
And a patient can't get a doctor to do that, right? No.
Well, a patient can ask, like, let's say you go to your doctor and they say, I think you have fibromyalgia. The best question you can ask is, what else could it be? That's it. What else could it be? Because they are going to have to come up with, we call it a differential diagnosis. All right.
Yeah.
And even if they are not going to be the ones to go down the diagnostic route of figuring out if it is one of those differential diagnoses, that's something that you can go to another physician and say, hey, I had someone consider that I could have ciprofloxacin toxicity. Do you think that this could be ciprofloxacin toxicity? And you really have to put it in the mind of the physician.
Yeah. So for everybody out there that's been misdiagnosed and knows they're misdiagnosed, or gaslit or whatever, what kind of advice would you give them beyond, I mean, what you just said? Is there any other advice you could offer us in this situation? Like, because once they make a diagnosis, you can't get out of it. And so, like, what tips are there that we could do, or what power do we have, is what I'm trying to say.
Mhm. Well, you have the power to choose who you go to. Okay. That's, I completely understand that in some cases there are care deserts. In some places it is financially prohibitive to see multiple physicians. But outside of the emergency room setting where you pretty much, you get who you get, on an elective basis, you have the power to choose. You are not locked into any physician. This is a voluntary relationship. And you are going to a doctor for their opinion. That is our job, is we give opinions. So, while it may make the road longer and it would be a heck of a lot faster and cheaper and more efficient to find the person who knows what you're dealing with first, just know that that first opinion may not be correct, and it is in your power to try and find someone else. Now, I hear a lot of patients say, well, I've tried to go to the Mayo Clinic and they've rejected me from the Mayo Clinic. I hear that also. The Mayo Clinic is not the end all be all. Okay. And oftentimes there are physicians who are local, but you just may have never heard of them before. I tell patients often to look at PubMed and see who are the physicians who are actively doing research. One tip I will give you is that a lot of the times when people publish research, the physicians are usually at the end of the list of names. Usually sometimes they're the first author, but oftentimes they're not. And so if you are looking for who are the physicians who are actually treating Ehlers-Danlos, MCAS, POTS, long COVID, chronic Lyme, ciprofloxacin toxicity, use those resources.
Mm-hmm. So let me give you an example. Like, this is why I get so frustrated with, like, the psychological disorders, because the second that shows up on your record and you show up in an emergency room the next time, that's the first thing that they see, right? And as soon as that doctor sees you, they walk up to you and you try to start explaining your story, and they're like, I see you have anxiety. And that's where it goes. And you're like, no, I have all these physical symptoms. And I've had it before where they just send, like, psychiatrist over to me. No, I can't chew, I can't swallow, I can't, you know what I mean? And, like, what does somebody do in that situation? Like, just get up and walk out of the emergency room? Like, what are you supposed to do? Or, like, how do you change a mind? You know what I mean? Like, because I feel like it's this, like, scarlet letter on you, and everywhere you go. Like, how are you going to get past that?
So, to go back to, anxiety is kind of the classic, misdiagnosis. And part of the problem is that the medical conditions that you are experiencing make you feel anxious.
Mm-hmm.
Anxious is an emotion. Okay. That is normal. And anxiety is a warning sign. It is good to feel anxious if your body is trying to warn you that something really bad is happening. Okay. That is separate from anxiety disorder, right? Anxiety disorder is when that level of anxiety and alertness is out of proportion to what's going on, lasts longer than it should ever last, doesn't fit the circumstance, right? You're feeling anxious because you're going out to dinner with your friends. That's not, the right way. Or it's getting in the way of you doing your everyday activities, getting in the way of your life. If that is not the case, then it is within your right to say, I am feeling anxious, but this is not part of anxiety disorder.
Mm-hmm.
And have them, kind of explain to you why they would think otherwise. But I think, number one, differentiating between anxiety and anxiety disorder is very important. Even in the ER setting, you are allowed to speak your truth, right? So I completely understand that once you are, these ICD-10 codes show up on your chart, they follow you around. But I think it's just to bring it back to the physical symptoms, and you can say, put my anxious feelings aside. I want to discuss the physical symptoms and how we can treat those.
Mm-hmm. That's good advice. Definitely good advice, because it's hard, like when you're in that situation, to like not flip out. You have to keep your cool, or the doctor's not going to take you seriously. And that's what I try to tell people that are reaching out to me. I screamed at my doctor. I'm like, you can't scream at them. I know it's frustrating, but then it makes you look crazy, right? So
Correct.
yeah.
Correct. And it's more again about maintaining that dialogue of, even it is absolutely okay to acknowledge I have anxious feelings, but
Mm-hmm.
I'm having physical symptoms that I want to find a treatment for.
Mm-hmm. Yeah.
To
Yeah.
separate the two. Yeah. Because someone who's having a heart attack is anxious. And no one says, well, you have anxiety disorder, so we're not going to give you an EKG,
Mm-hmm.
right? Or we're not going to send you to the cath lab because you're anxious. Okay?
Mm-hmm.
Absolutely not. The anxiety is part of the heart attack.
Mm-hmm.
And so we just have to, again, be able to separate the feelings of anxiousness with the the diagnosis of anxiety disorder, and sometimes that means educating the physicians as well.
Yeah, so basically what you're saying is you need to become your own advocate, which is what I say all the time. And, some of the advice that I give to the people that reach out to me is have your script ready, have your questions ready, have your rebuttals ready, bring someone with you, because
Correct.
sometimes you just, they bring you back, that person. It's nice to have a second person there with you. And sometimes I've noticed doctors will treat you differently if you have someone with you. And in my case, if you have a man with you who's your husband, they treat you very different than when you go by yourself. That's been my experience. I don't know why, but that's just some of the things I noticed.
Yeah, absolutely, bringing someone with you, because it changes the dynamic of the interaction.
Yeah.
As I said at the top, there is a power imbalance when you are one-on-one, and just even having one more person helps to level that playing field, because now I'm not only responsible for communicating to you, but also to someone else who can vouch for, Talia is not, normally like this. This is a significant change in her symptoms and her behavior, and there is something physically wrong, right? It's
Right.
just another set of data points.
Right. And I think for everybody watching out there, people that are chronically ill, definitely those of us that are being floxed. I mean, you're hearing Dr. Erin Nance say this, but like, you have some power. I think we're so used to being in the system that what the doctor says is gospel and you can't fight back. Not even that it's fighting back, you're just sticking up for yourself. And this is one of the biggest things I say to people all the time. You have to advocate for yourself. Nobody cares more about your health and well-being than you. You're just another patient to that doctor, so you're going to have to be the one that does it. And bringing somebody helps, and like all the things you're saying is what I say to everybody. So please, if you don't believe me, listen to her. It's
Yes,
seriously making a
I did
difference.
a post at least a year ago where, I said the cavalry is not coming. Okay. It is on you. And
Mhm.
that may seem unfair, and that may seem like a huge burden. And it's not that doctors aren't there or willing or want to help you, but exactly what you said is what I have said. There is no one who cares about your health and you getting better than you. So you really have to be the driver in this situation.
Mhm. One of the things in your book, I really did love your book, by the way. I keep saying that. One of my favorite quotes about doctors was, "There is a way to preserve a person's dignity, even in times where they feel stripped naked." which I feel like many of us have felt like this most of the time when we go in there with a diagnosis, with a illness that doctors don't know how to treat or don't understand. Is there a way we can preserve our own dignity in these situations instead of hoping that we have a doctor that will be nice enough like you to do it?
You know, dignity is something that you hold on to. And even when you may be in a situation where you feel like a doctor is not listening to you or you're not being seen or heard, you know your truth. And I think as long as you hold on to your truth, that is what is going to get you through those really, really hard moments. And I'm not here to say that it's easy, right? This is the whole, problem with gaslighting and misdiagnosis. And the more times you hear nothing's wrong, you start to question yourself, right? And think,
Mhm.
is something wrong with me? Am I crazy? Am I making this up? But reality will always hit. And you did not make up these symptoms, and they are not going anywhere. And so just believe in your truth. And I think that is the best way to maintain your dignity.
Yeah, and I think the other thing that people are, afraid of is that once the doctors start saying that, their support system also starts saying, "Is are they crazy? All the doctors are saying it." Like your support system starts whittling away, so you're grasping onto everything, like, "Look, pay attention to me. Oh, I don't want to lose my family, I don't want to lose my friends." You know what I mean? It's a really tough situation to be in, because again, people believe whatever the doctors say goes.
Yeah.
So I know it's been very hard for a lot of us that are sick to try to get family members and friends to believe what we're going through and what we're experiencing.
Yes, and I did a TEDx talk last year, exactly a year ago, called "You're Not Crazy: The 7 Stages of Misdiagnosis." And I did that talk because I recognized this pattern in people who had been misdiagnosed was the same again and again and again. And this stage, one of the stages is self-doubt. It is part of the pattern. So I did the talk because I wanted people to know there will come a time when you start to doubt whether or not these symptoms are real, right? This is, I think it's like the 4th stage. It is part of the pattern. And so it's something not to worry about and be like, oh my gosh, now I'm doubting myself. This is part of the process. And if you know that this is how other people go through a misdiagnosis, I think it will help you snap out of it faster and realize this is just one part of the process. And how can I move on to the next stage?
Hmm.
Which
Yeah.
unfortunately turns out to be anger.
Yeah.
because, because what happens is after you've even doubted yourself and the symptoms don't go away, you go, wait a second, I'm not crazy. I'm not making this up. These are real. And you become really angry.
Yeah.
And that is also part of the process.
Hmm.
So this is just to warn you, for anyone who is going through a misdiagnosis, I highly recommend, it's on YouTube. It's called The 7 Stages of Misdiagnosis, but I think you will feel so validated after you listen to it.
Yeah, I'm gonna post it when I make my little clips, so everybody has access to it. I'll find. Oh, Dr. Jacqueline is putting it up there now, so yeah, I'll definitely take a look at that. Um, do you want to talk about your brand new platform? I think you said it's the first physician platform ever for medical information. Takeaway MD.
Sure. I started on TikTok about 3 years ago. I started Little Misdiagnosed almost exactly 3 years ago. And what I understood about the power of physicians on social media, right, is that we are really good at just creating a space for other people who have had shared experiences and lived experiences to find one another and connect with one another. And, there's so much misinformation on social media. Don't get me started about, Facebook groups and everything. But what I thought is there's really good information out there too. And what if there was just one go-to place where people could get health information from trusted, verified medical experts, okay? But then also meet people who have gone through the same problems that you have gone through. So that really is, the basis of Takeaway MD. It's a medical social media platform. All the content comes from vetted physicians, but we also have built in a community research layer and a community trials outreach layer, because I believe that patients learn just as much from the physicians as they do from other people who have gone through the same problems, right? I'm sure in your Flocks community, you learn so much more from people who have actually gone through it. But at the end of the day, you do need to work with the clinicians who have the access to the treatments, right, and the diagnostics that you need. So we need both parties to be working together to help everybody.
Mm-hmm. So they can just go to the App Store and download Takeaway MD. It's like black and green logo.
Yes, it's black with a green Takeaway MD logo. We debuted at number 7 in the App Store for all health and fitness apps, because I knew that this was something that people were hungering for, right? When you get diagnosed with something at 2 a.m. and you go to Google, that's terrifying, okay?
Mm-hmm.
When you go on to TikTok at 2 a.m., that's terrifying. So we wanted a place where we could get the most relevant content for you, and then also put you really in touch with the community that's live on these videos, who everyone who is on that video is on there for a reason. So we built the platform not based on popularity of the views, but based on trying to match the content with your health symptoms and conditions and interests. So our goal is not to have people spend hours and hours on this platform. Our goal is to have people come to the platform and hopefully get the information that they need.
Mm-hmm. And I would say, people that don't have something that's common should still sign up for this app. And get our stuff out there and get people talking about it. So for everyone
Absolutely.
Block says,
And
well, nobody knows
yes.
about it anyway, I'm not going to sign up. Sign up. I signed up.
Correct. Because as I was telling Talia before we came on the show, that the platform is a general health platform. So we have over 500 physicians and there's over 1,200 videos on the platform now. But the platform, it was only launched 2 weeks ago. The platform will continue to grow with content. But really, if you have a very rare disease, just even entering the platform and signing up for the community research, we are soon going to be able to translate your story into insights for the community. And that's what we really want to do, right? If you have 100 people in your Cipro Floxed Facebook group who are all saying basically the same thing, it only lives in comments on a Facebook group thread, right? Whereas what we're trying to do is take a research approach to saying, okay, we have 100 people with ciprofloxacin toxicity, and we've learned that symptoms show up 3 days after they started the medication, right? And I'm just saying this out of the blue as an
Yeah.
example. But we want to be able to actually use the information you give us to help provide insights to someone who may not even have a diagnosis yet, right? All they know is, I started on Cipro for UTI, and now my Achilles tendon is killing me, right? They may not be able to connect the dots immediately from just looking up on Google, because Google is primed to show the most common scenario, right? And they would say, oh, you just have Achilles tendonitis,
Mm-hmm.
right? They're not taking into consideration the fact that you took ciprofloxacin 3 days prior. Whereas on Takeaway MD, when you enter your symptoms and conditions, we know you've taken Cipro, it's 3 days later, we're going to show you content about ciprofloxacin toxicity because that may be relevant for you. We're not diagnosing you with ciprofloxacin toxicity, but again, we're giving you the language to go back to your physician and empower you to have a more educated and better conversation with them.
Mm-hmm. Yep. I like the app. So make sure you make sure you all download it. Take 2 seconds.
Thank you. Yes, it's I hope, we are going through many versions very quickly, and we're trying to make it as user friendly as possible. But in the end, we want it to really be that trust, that safe and trusted place where people go to get credible health information. That's the easiest way to think about it.
Yeah. Before, yep, there it is, black and green. Before I get into the questions with the users, I end every show with a message of hope. And I am going to bring in the quote at the end of your book that had me crying my eyes out. You wrote at the end of your book, the night of Kevin's accident, I learned that the most powerful drug is hope. Hope that you will be the one to beat the odds. Hope that the surgeon will know how to fix the problem. Hope that the recovery process will go smoothly. Hope that you will be able to live a fulfilling life no matter how many medical obstacles are thrown your way. So can you please give our viewers a message of hope who are chronically ill, misdiagnosed, and or floxed, whatever?
I will tell you that there are so many people who care about you. Just in my own circle of physicians who, listen, I have over 500 physicians on our platform. They don't receive any compensation. There's no glory. There's not even view counts on our videos. There's no reason to be on this platform other than to help people get better information and better care. So I want you to know that there are people who care. In fact, this is a plug for a friend of mine, Dr. Bayo. She has compiled a website called Clinicians Who Care. It's literally thousands of doctors who patients have recognized this is someone who cares, right? Not just they're a good doctor, but they care about me. So if you're looking for a resource, you say, hey, I'm in Phoenix and I can't find an OBGYN who will treat me for endometriosis. You can go to that website and literally look for a clinician who cares about you and treats endometriosis. There you go. Clinicians Who Care, a great plug. And it's these physicians and the work that we're doing that really give me hope that we will one day be able to have everyone feel seen, everyone feel heard, because that's what you deserve.
Yep. Thank you. Do you have anything else you want to say about misdiagnosed or anything before we're going to take a couple questions before we go?
I love, I will say this. People ask me, why do I post all these videos and why do I, spend all my time making Takeaway MD? It brings me tremendous joy to do this. When I think of, I still see patients, I'm still a practicing hand surgeon, but I may only have an impact, for the 10 to 20 patients that I see per week. My impact on as Little Misdiagnosed and my impact as the founder of Takeaway MD, this really is my service, right, to the public. And this has brought me such tremendous joy. And I want you to know that it's an honor to serve you. And those are the physicians that you should seek out. Those who we see, our role, it is a calling. We are in service to people. And I hope that you're able to surround yourself with physicians and other care team members who feel the same way.
I can tell you for sure, we see your heart. There's no doubt about what your motive is in your videos. So thank you very much.
Oh, you're so welcome.
Do you have any questions? Look. How would you treat those of us that have been floxed? I don't think she's an expert in fluoroquinolone toxicity.
Well, I will say that as an orthopedic surgeon, I have treated patients who have had tendon ruptures with fluoroquinolone toxicity. And what's interesting is that the physician who prescribes the medication is not always going to be the physician who's going to be able to handle the complication or even recognize the complication. And that is something that I think as patients, you may not understand. And it's just something that, as someone who is proactively being prescribed medication and taking a medication, in the end, it is up to us to understand the risks of said treatment and medication. That doesn't mean that you are responsible for all 100 possible side effects and being on the lookout for what that could involve. But I would say that, for example, if you took Cipro and you started having tenderness in your Achilles tendon, I would say it's on you to start the research and then go to the physician who you think is going to be the most likely to help you. And it may not be your internal medicine doctor who prescribed you the medication.
Yeah. What do you think about adipose stem cell treatment? Do you know what that is?
Well, stem cell treatment has been around for quite some time and for many different usages. I mean, I even know in my own brother's case, who has a spinal cord injury, there are different physicians in China who do stem cell trials, and there's a lot of different trials for stem cells. And our job as physicians is to be able to make recommendations on treatments that we know are going to be safe and successful. As a hand surgeon, like for example, there is an injury called scapholunate ligament tear. It's a devastating injury. It's very difficult to treat. And why I don't like necessarily recommending that treatment to patients is because I have to say it's only 50-50 if it's going to help. And that is it is an expensive, it is a time consuming, it is a big recovery process for a procedure that I don't have great confidence is going to help. So stem cells really at this moment in time fall into that bucket, right? Is there a potential to help? Yes. Do we have a predictable safety profile of that treatment? No.
No. Yeah. I completely get that. That's why when everybody asks me about stem cells, I'm like, nope, I have not done it. I'm not willing to take a risk. But I think we're coming up at the end. And this is you on TikTok. Almost 1 million.
No. Oh yeah, this is, I want to say, because I have to be very careful. On Instagram and Facebook, there are many scam accounts.
Oh,
And
okay.
so on TikTok, this is me, Little Misdiagnosed, absolutely. And then I apologize because social media was not my main job. So I should have the same handle across all the platforms. But on Instagram, I'm Dr. Erin Nance, spell doctor out the full way. And on Facebook, to be honest, I don't think any of those accounts are me. So
Oh no.
there are accounts that have over 100,000 followers that are not me. There are accounts that they just used to steal my content from TikTok and then upload them. And because I never took the time to have a Facebook account, that's why they've grown. But I would say most consistently, you can follow me on TikTok. And now my hope is that everyone will use Takeaway MD to see all of the vetted physicians. Yes, this is me on Instagram.
Yep. All right, so thank you very much for joining today. I really appreciate your time. I know how busy you are. And that concludes today's episode of This is Floxed. I'll see you all next month. Stay healthy and download Takeaway MD. Thank you.
Is it true? Is it kind? Is it necessary? In a world quick to judge, one book dares to reveal the hidden cost of silence. Discover Holy but Harmful, The Silent Sin of Judgment, How Hidden Judgments Destroy Relationships and Damage Lives by Dr. Jacqueline Kerbeck. The Amazon #1 bestseller that's transforming the way we understand ourselves and the way we see others. Pick up the companion workbook to uncover your own hidden judgments and learn how to break free from them. Available now on Amazon and at fine bookstores worldwide.
USA Global TV and Radio proudly presents Tracy Cram Perkins, a dementia caregiving survivor teaching how to balance care with peace of mind. #1 resource for dementia caregivers. It's the book Dementia Home Care: How to Prepare Before, During, and After. Over 17,000 copies sold of this must-have guide. And now a testimonial from Tracy Smith.
If I was to describe this book to someone who is going through a similar situation, I would underscore how important it is to have some sort of a tool or a guidebook to help you through certain stages. And there's so many, it's such an unknown topic to the average person. And to have this as a reference is essential. It's going to help you get through it personally, as well as help your loved one manage.
To learn more, go to TracyCramPerkins.com. Tracy Cram Perkins is an award-winning author. She's also the host of Dementia Home Care television show. Watch it here on USA Global TV and Radio.
Thank you, viewers and listeners of USA Global TV and Radio, for joining us today. We're honoured to have your time and attention as part of our global community. At USA Global TV and Radio, we believe in the power of authentic conversations, meaningful connections, and creating a world of possibilities together. Want to be part of something bigger? Join our team of elevated listeners at usaglobaltv.com, a space where your voice matters and your ability to listen transforms relationships. Stay connected with us across all our platforms for thought-provoking discussions, expert insights, and empowering stories. Subscribe to our channels at youtube.com/c/USA Global TV. Follow us on social media and explore the endless opportunities we're creating for growth, learning, and inspiration. Together, we're not just broadcasting, we're building bridges and changing lives one conversation at a time. For inquiries, contact us at info@usaglobaltv.com. Produced by Executive Producer and Director Dr. Jacqueline Kerbeck. Voiceover by Mike Porter. Creative direction by Paul Garcia. All rights reserved. Visit usaglobaltv.com to view our full terms and conditions.